Hi everyone. Today is my first lecture about neurology. That one is the introductive part, and in that introductive part, I will teach you that first of all how you remember the basic neuroanatomy. So today is the first lecture about neurosciences, that is about neurology. So let's talk about the meningeal layer. So if you can see that there is a our meningeal layer we also call protective layer, like dura mater, arachnoid matter and pia mater. So these three are the we collectively called meningeal layer. So that meningeal layer protect our brain against any injury. This is a bone, and this below the skull bone we call dura mater, and this we call arachnoid matter. Between the arachnoid and pia mater there is a space. That space, if you can see, this space we call subarachnoid space. So subarachnoid space contain blood vessels. Subarachnoid contains CSF. So as you can see, this is the blood vessel which are present in subarachnoid space, and CSF is also present here. Circle of Willis is present here. So this space is very much important physiologically as well as anatomically. Okay, and this is the brain. So pia mater is a very soft layer and very thin layer that protect the brain as well, and this collectively we call what meningeal layer. So meningeal actually it's a protective layer for our brain. Then we talk about neuroanatomy, about the neuron anatomy. What's the basic anatomy of neuron? So basic anatomy neuron is like that. This is the central part, or you can call, there is a nucleus, and then there is a cytoplasm, and this is a dendrites. So first neuron can communicate with another neuron through this communication, and this is the axon. So this axon is a conduction pathway for electrical impulses or message. When any message we travel from one neuron to another neuron, so it's a main pathway or main bridge through where conduction can be happen. So this is a myelin sheet. Okay, myelin. So this is a myelin is a protective for axon. So actually this myelin sheet is made up of vitamin B12 as well, vitamin B6. So if anyone deficiency of vitamin B12, so he or she might develop some burning, some tingling sensation. Why? Because there is no normal conduction. Abnormal action potential lead to abnormal message, and this is we call the terminal part, which also connect with another neuron. Okay, now let's talk about the basic anatomy. So as you can see in the picture, this is we call frontal lobe and temporal lobe, spinal cord, cerebellum and occipital. So frontal region is the major motor system which can finally produce any or enhance any motor activity, and this is the parietal lobe which take the sensation from the periphery to the center, and this is the temporal lobe. Frontal and temporal lobe is very much important if we talk about speech area. Why? Because temporal lobe contain Wernicke area, which is the listening part of our brain, and the frontal lobe that contain Broca's area. Broca's area is the one which act as a producing of sound. So Wernicke area we call comprehensive, and frontal we call receptive. Temporal lobe we call receptive, and frontal lobe we call comprehensive. And then there is occipital lobe for vision, balance, and cerebellum. Cerebellum we also call little brain. Okay. Now let's talk about the types of peripheral neuropathy. So there are four major types of peripheral neuropathy, including motor neuropathy, sensory neuropathy, autonomic nervous system, and mixed neuropathy. So in the motor neuropathy, what happens? There is a damage to the nerve that control muscle movement, such as talking, walking, and exercise. If anyone has some motor neuropathy, so patient might be difficulty to talking, like the patient cannot talk very well, can be happen in stroke, walking can be happen in like sciatic nerve damage or exercise. Then there is a sensory neuropathy. In sensory neuropathy, sensory nerves control what you feel, what you touch. So in that neuropathy, abnormal sensation. And autonomic means mixed, that autonomic nervous system including parasympathetic and sympathetic system. So because you know that sympathetic system innervate the heart, stomach, liver, eyes as well. Okay, so anyone like in the diabetes, a autonomic nervous system is very much common to be affected. So it's very common. And mixed neuropathy affects both motor and sensory system. As you can see in the picture, how we check the sensation as well as motor system. Anyone develop any motor neuropathy, so see in the hand, so abnormal flexion, extension, and we checking the sensation in here. We also check sensation in the diabetic patient, same like that way. So what's the causes of peripheral neuropathy? So main causes of peripheral neuropathy, that the vitamin B12 deficiency, which I already taught in previous slides, because it is the one which make ascending tract properly myelinated. That one is very important, because if someone develop any vitamin B12 deficiency, so that patient unable to take the sensation from the ascending tract to the sensory tract. Ascending tract we call sensory tract. So that tract become dysfunction. So patient feeling abnormal sensation. Diabetes mellitus is very much common in United States and as well in Pakistan. Okay. So in the spinal cord injury, if someone develops spinal cord injury, so patient also can suffer with peripheral neuropathy. In ischemia of the spinal cord or any tumor or autoimmune disease like Guillain-Barré syndrome, autoimmune disease, and HIV infection. Then you can see in the picture this myelin sheet, and this is the normal basic anatomy, how you will see. Then clinical presentation of diabetic neuropathy. Peripheral neuropathy in diabetes mellitus patient as well as can be ANS dysfunction. So peripheral neuropathy, how the diabetic patient present the clinical feature, like peripheral neuropathy clinical features in diabetic patient will be like that: numbing or tingling sensation in the palmar aspect of hands and sole, or decreased sensation toward any stimuli, or decreased sensation to feel and change of temperature. So diabetic patient unable to sense the temperature very well. And then ANS dysfunction, like there is a gastroparesis, vomiting, decreased appetite, loss of bladder control, stomach control. So that's very important. What's the complication of diabetic neuropathy? Hypoglycemia, because there is no awareness properly, that patient don't know when her or his blood sugar level become down. Why? Because there is no proper innervation, no proper sensation. Then there is a loss of toe or foot. We call when someone develop diabetes, so that diabetes can affect the nerve and they not provide proper circulation to the blood, to the nerve. So that nerve become damaged and there is an abnormal sensation and eventually lead to what? At that type come, a doctor will cut that foot, or we call amputation, and there is a urinary tract infection. So see, in the diabetic mellitus patient complication, same like that. So this is how this disease present. Then what's the complication of diabetic neuropathy? Blood pressure regulation problem or GI tissues like digestion problem and disturbed temperature and regulation system. So I hope guys you understand today very well. So inshallah in our next lecture I will discuss further about neurology. Okay, thank you.